Hello, I'm Marites Vitug. Welcome to Southeast Asia Speaks. This is the show where I get to interview resource persons and newsmakers on issues affecting the region. I will be speaking to Manuel Dayrit, a medical doctor and former Secretary of Health. On his watch, the Department of Health effectively contained SARS in 2003. He's also a former dean of the Ateneo School of Medicine and Public Health and is currently teaching there. Dr. Dayrit is one of the editors of this timely book, Countering COVID-19 Cases in Crisis Response. It was released recently by the Ateneo University Press. Thank you, Dr. Dayrit, for making time for this interview, and to our live audience, we will be talking about this book and related issues. So I think the first question, Dr. Dayrit, is what are the key messages of your book? Why should people buy it and read it?
Okay, Marites, thank you. Well, this book, it is a 336-pager, okay, 3 editors. It was published, just published, but it actually contains content that looked at how we managed the epidemic during the first 6 to 10 months last year. And therefore, it contains essays from about 30 authors, recognized experts in their areas, including, for example, public health. We had economists, financial experts, and political scientists. Now, the book was divided into 2 parts. One part on public health policy and the pandemic, and another part on sectoral concerns. So the overarching messages, had to do with issues of early recognition, organizing and mobilizing, and making sense out of this pandemic, and communicating and community engagement. So, for example, one of the themes was this pandemic government whole of society response. So something like that we can sort of reflect on and assess how well were we able to do it. Okay. Another theme had to do with our state of readiness. Were we prepared to confront this epidemic? Another theme had to do with our actual response. For example, theoretical policies about quarantine, which were good on paper, didn't work, particularly in densely populated areas, urban poor areas, where there were no quarantine facilities. And of course, on the positive side, accelerated learning on how to deal with this pandemic. And of course, themes about providing people with the right information, making sense of what was going on, and even protecting workers, against the infection.
So actually, this book can be a potential playbook for responding to future pandemics?
I would say so, Marites, because even if it was written during the early part of the pandemic, the lessons are the same. And for example, now, we're facing a possible surge. You ask the same question. How prepared are we? Have we made sense about what is going on? Okay. How about social protection and the need for that? Are we ready for that? Protection of the workers. And this is interesting in the light that a year after, we're now at a higher level of, you might say, capacity, where we're now implementing a nationwide vaccination program. So it makes, the discussion very, very interesting. And reflecting on how we dealt with the epidemic early on, we can learn lessons and transfer them to the situation at the moment.
Yes. So before we talk about the Philippines in more detail, Dr. Dayrit, you co-wrote a chapter on global responses to COVID-19. What are these broadly, and what lessons can they share with the Philippines?
Marites, that really had to do with some recommendations by the German National Academy of Sciences. And they talked of 4 categories of response, in that chapter, okay? The first category of response was protecting particularly the vulnerable. And they call them systematically relevant population groups. So, for example, health workers are a systematically relevant group. That's our A1 priority for vaccination. And of course, the elderly, they're the most vulnerable. So that was the first category, protection of the vulnerable and relevant population groups. The second had to do with diagnostics. Because you had to have good diagnostics. And early on during the pandemic, we weren't really that, equipped for that. Okay, so having the good diagnostics early on. And then the third had to do with development of drugs and vaccines. Of course, we don't have a vaccine development facility, but we had to buy and procure. And then the fourth, very important, had to do with information and education. So these were the four categories of responses that the German Academy of Sciences were proposing. And we could learn from thinking about these categories.
So now we can look at the Philippines, and maybe Dr. Dayrit, you can tell us the story of the Philippines in more detail, since there are so many lessons to learn from this experience. So I think
okay, to do that, I prepared the slide. Okay.
Correct. Okay.
Can you put up the slide on the Philippines? Yeah, look at that. This is the epidemic curve of the Philippines. Okay, and just follow the bold line. Okay, the bold line shows that you had a peak sometime last year in August. It went down and then a peak again sometime in April and May. That's the story of our epidemic. Now, what can we learn from this? One, for example, you can see the green bars there. That's the National Capital Region. And the gray and yellow bars are outside of NCR places, localities. And you can see that the share of the epidemic is greater in NCR at the start. But then the share outside of NCR then grows. And you can see that both in the first peak as well as the second peak. And then when you look at that also, you can see that after the peak, the solid line doesn't quite go back to where it used to be, whether for the first surge or for the second surge. And therefore, what is happening there is we're actually having a propagation of the infection. We are not able to suppress it down to zero. And this is the story of the way we have managed it. And that's quite interesting. If you go to the second slide will show that in quite interesting detail. Jaira, there. So this is just the epidemic curve, told it in a different way. But see, there's a peak, and it's because of this beta-1 variant, okay? And then soon after that NCR peak, you have that peak in the provinces. And that was the case even before the early part of the epidemic, but it wasn't so pronounced. And then it goes down. It doesn't go down quite to pre-surge levels. And then you had the second peak in NCR. Now, this time, due to the alpha and beta variants, that's the UK variant and the South Africa variant, and then propagation in the provinces. And you can see that the level of infections are much higher than the pre-second peak. So the story of our epidemic is that, it's just propagating. And more people are getting infected. And after a surge, you just have so many cases in the population that it's harder for it to control and bring down to pre-peak levels. That's the story of our epidemic. Thank you.
So now, Dr. Dayrit, the government, IATF, has downgraded our target for vaccination and instead focused on the NCR plus 8 areas. So I think you can talk about that. What is the advantage or the science behind that strategy? And maybe the step after that, are we going for herd immunity?
Yes, the science behind that is actually summarized in that second slide that I showed you, where there is first a rise in NCR and then a subsequent rise in the provinces. And therefore, they conceived of the NCR plus 8 strategy and said it is in NCR plus 8 where you have that large first surge. And if we contain the epidemic there, you can prevent the second surge in the provinces. And that's why they're saying, let's prioritize NCR plus 8. That means giving them the lion's share of the vaccines, even as you distribute vaccines outside of NCR plus 8, but give them the lion's share of the vaccines and try to prevent propagation in NCR as well as outside of NCR. So that is the whole scientific basis for that strategy.
So after we achieve vaccination of 70% of NCR plus the 8 areas, the next goal is to reach herd immunity, or is this still far off?
Well, we're really work in progress for the vaccination program. As of today, about 18.7 million doses have been delivered. Of this 18.7 million doses, about 7.2 million are fully vaccinated people. Okay? Now, I'm computing, but this is just my calculation, that the lion's share of that 7.2 million, let's say 4.5, maybe even 5 million, is actually fully vaccinated people in NCR. So if you just work on the assumption that it's about 5 million in NCR plus 8, we're now at around that 5 out of 7, that's about 40+% or more. And therefore, we're still not quite at 70% for NCR. And that's the target towards the end of the year. And so we have to continue our vaccination program to achieve 70 or 80% in NCR plus 8, and then maybe achieve 30% in the provinces, because at 30%, you are able to slow down the progress of infections, even the infections by the variant. So that's the strategy.
So you think that by the end of 2021, we would have achieved the 70% of the NCR plus 8?
That's the goal. That's the goal. And I think we're doing quite well, because I attend the daily meetings, and they're vaccinating now. They're reaching 500,000 jabs a day. They used to be averaging 150,000 to 150,000 daily, but now they're jabbing at the rate of 500,000, maybe even 600,000. Hopefully, and they're targeting as high as 750,000 jabs a day. And if we're able to do that, we will achieve 70% in NCR by the end of the year.
That's great to hear, because I think the private sector has started its own vaccination program. So I think that put up the daily number of vaccinations. But
yes,
so that's the case. Let's go to Southeast Asia to have a bigger picture, because I was going to ask you anyway about the success of Thailand, Vietnam, and then now they're experiencing a surge. So what's their story compared to ours?
Okay, let's show the slide in Southeast Asia. And there are several countries there. There are 8 countries here, okay? And let me just show them. Indonesia, Philippines, Malaysia, Thailand, South Korea, Vietnam, Singapore, and Taiwan. Let's just take, for example, Taiwan, and let's say even Thailand, okay, and Vietnam. Look at their curves. In Taiwan, they bent it towards the horizontal almost immediately. So that's how they controlled it. So last year, they were living a normal life in Taiwan because there were no infections there. That was the same thing that happened in Thailand. And also in Vietnam over here, okay, they were able to bend it. But what happened is that, particularly for Thailand and Vietnam, while their health systems had capacity to contain the less transmissible variant. When the more transmissible variant hit them, it overran their capacity. The problem with Vietnam and Thailand is they did not begin vaccination early. Okay, because they were thinking, well, we've been able to contain it. And you can see this is like round two. And therefore, you can't let your guard down. And because they weren't able to vaccinate early, they're now trying to play catch up. And they're playing catch up in the midst of a surge. As you can see, Thailand and Vietnam going up. You can see Taiwan was still able to control it because it's small island, population. They had a huge surge, but apparently they've been able to flatten their curve again. Okay? So look at that in comparison to the Philippines and Indonesia. The Philippines and Indonesia, we were never able to contain our epidemic. It was propagating all the time. So the main difference is when you look at these countries, the Philippines and Indonesia have millions of cases compared to Thailand, which at the moment is only 500 million cases, and Vietnam, which is 100,000 cases. Okay, but I guess, in a sense, the silver lining for Philippines and Indonesia is that, yes, we had a lot of casualties, but because a lot of people got infected, natural immunity went up. And with vaccination now coming in, we're probably getting our vaccination levels in the population higher. And therefore, nothing's perfect. No response is completely perfect. And that's why even for Singapore, which did very well, they're looking at a situation where they'll consider the infection endemic and then just keep vaccinating and just live with the infection. And by doing that and vaccinating the greater part of your population, you hope that fewer and fewer cases actually get seriously ill. So your hospitalizations for serious illness and your deaths will actually not rise.
So is it fair to say that Thailand and Vietnam became at some point complacent? And that's why you said they delayed vaccination or they were slow to start their vaccination. Somebody said they're victims of their own success. Is that fair?
In a sense, one could say that. Okay, but you see, you can't blame anyone here because it's the dynamic of the political system and the health system. And you see, I think Vietnam and Thailand were having controlled the infection. We're saying, okay, we can wait a bit and decide what vaccines to use. I know that Thailand was saying, oh, we'll manufacture it ourselves. Vietnam said we'll manufacture it ourselves. They didn't procure. Whereas the Philippines, oh God, we were on the ropes. And therefore, just buy vaccines. And the strategy was buy a portfolio of vaccines. Anybody that had a approved vaccine with an emergency use authorization, we would buy. And that's why we had a whole portfolio of vaccines from Sinovac, AstraZeneca, Pfizer, Moderna, Gamaleya, and, we just bought them. And so in our population, you have a mix of people who are vaccinated by all of these different vaccines. So that also is interesting because that is different from the situation in Indonesia, where most of the vaccinations in Indonesia were through Sinovac, almost 100%, I believe.
So yeah, now in Indonesia, they're I think have ordered or scrambling to order the mRNA vaccines. And they're even talking now of booster shots for their medical frontliners. Are we already in that stage about thinking about booster shots here in the Philippines? Because Thailand is thinking about it. In fact, they already have, I think, started. And also in Indonesia, they're about to start. So how about us here in the Philippines?
I asked that question already of the experts and of the managers of the pandemic here. And the answer was they're still comfortable with the portfolio of our vaccines. And we'll stay the course and just achieve maximum coverage of the unvaccinated. before we start even boosting those who are fully vaccinated.
Okay, how about in other countries like Turkey, I forgot, UAE, I think that they encourage some of their citizens or 50 and above to have themselves revaccinated after being vaccinated with Chinese made vaccines. Have you ever thought about revaccination or 6 months after the second dose?
That's a possibility. I'm sure our government managers have thought of it, but they've decided against it yet.
So it's the equity issue first
Yeah,
to
right.
cover most of our people.
Yes.
But can you talk about the Delta variant? We are at an interesting stage as we talked offline earlier because we sort of went into confusion yesterday when we read about the business sector agreeing to a lockdown in August. And then Malacanang announced that there's no lockdown yet. It's just the usual GCQ with heightened restrictions until August 15. So where are we now? And have you any recommendation to make, or shall we wait for our decision makers?
Well, I think we really have to wait for our decision makers now. But with regards to Delta variant, our Philippine Genomic Center is doing genomic sequencing of samples of RT-PCR tests. And at the moment, my information, based on the latest report of the Philippine Genome Center, July 21st, was that the Delta variant only comprises about 3% of the samples collected. The predominant variant is still Alpha and Beta. Alpha is about 50%, and Beta is about 38-40%. And so that's the reason why, our DOH officials are saying, there's no community spread of Delta yet. But there are people who are saying, well, why don't we just assume that there's already Delta spread? Because our Philippine Genomic Center gives the data 2-3 weeks later.
Correct.
And so that's the debate. Okay, that's the debate. And as you can see, the government at the moment is still not wanting to move into a lockdown based on Delta spread because the Philippine Genomic Center data still says the Delta variant is low. So the explanation then is that our pandemic is still being fueled by the Alpha and Beta variants. And we have to control them in the ways that we know how, which is minimum health standards, social distancing, and, restricted mobility wherever you find these local surges.
But as you said, Dr. Dayrit, the Philippine the results of the sequencing come out 3 weeks late, and you also said that we were told to assume. The OH said, let's assume there's local transmission. But the worry also is that lockdown is becoming a default response. And then I think you talk in this book, which I want people to read, is that you talked about balancing. I think your authors talked about balancing the lockdown and other responses. So maybe just put the lockdown, please, in context and what role it plays.
Because the lockdown, we used to lock down before, really to save the health system and not to exceed its capacity. I think now, even as that is a goal, there are a lot of other considerations, which is, people's jobs, social amelioration funds availability, everything, including the whole psychological impact on the population of another lockdown. So at the moment, they're really struggling with this question. And if they're going to lock down, the question they're asking themselves is when? What's the proper timing for it? Like, for example, would you lock down at this time when there are monsoon rains? When in fact, people are maybe mostly staying home. Okay, and so on and so forth. So I think these are some of the things that they're discussing. Of course, I'm not privy to their discussions, but I can imagine that these are the issues that they're discussing. It's not an easy discussion or decision. Okay, and I really defer to them, both the experts and everyone that's involved with the decision making, because there are a lot of perspectives that have to be considered, and eventually they'll just have to weigh, as they say, the benefits and risks, and then just decide. And when they decide, they should decide and have people prepared for what's coming. Okay, I think that's one lesson. Don't lock down precipitously and catch people unawares. Prepare for the lockdown if you're going to lock down, and then prepare people and so that they know what they're going to do and how they're going to, you might say, cope, with this hard lockdown period.
So one final question, Dr. Dayrit. We have not received questions from our audience. Maybe they're into other, they're still in work. But anyway, I'm interested in what you said about Singapore already planning to live with COVID-19, with the virus, and they already have a plan to consider it part, no longer an academic, but an endemic part of their society. Should we already start thinking of this? Or, shouldn't policymakers already?
I think we can start thinking about that once we have the majority of our people vaccinated. Because by that time, we would have achieved a certain level of immunity. We'll be at a stage where we'll be giving boosters. And then hopefully the combination of natural immunity and vaccine-mediated immunity is going to increase the level of resistance against the virus. But of course, Marites, the virus plays a lot of other tricks, no? And who would have known that after the Alpha and Beta variant, they would come up with a Delta variant? And if you look at what's happening in other countries with the surges there, variants could occur there and eventually even be more, serious than the Delta variant. So, we just also have to support and hope that other countries are able to do their jobs to control the pandemic in their own borders.
Okay, thank you very much. On that note, may I remind again our audience that you can get this from Ateneo, and I think Shopee and Lazada. So thank you very much, Dr. Dayrit, and to our viewers and listeners. We will continue this conversation. As you said, Dr. Dayrit, it's so it's a moving target, and changes happen in most unexpected ways. So thank you, and we will keep your message in mind about being prepared. Policymakers should make us communicate to us and let us know, plan well for the eventuality of a lockdown. Thank you very much and good day.